Hi, I'm Robert Junk with Radiology Planning. I'm joined here today with Tobias Gilk, Senior Vice President, Radiology Planning. We're here to introduce you to the new dual MRI suite at Wheaton Franciscan All Saints in Racine, Wisconsin. We're here to highlight some of the special features of this suite, including its ability to maximize patient safety and patient throughput, as well as a future-proof design to allow Wheaton Franciscan to continue to provide healthcare into the 21st century. Some of the unique features of this MRI suite that we're going to demonstrate to you are the two dedicated paths, one for outpatients, one for inpatients. In a few minutes, Toby will walk you through the outpatient path that a patient would go through as they came to receive an MRI scan. After that, I will take you through the inpatient process. We'll both end up then into the shared control room and talk about some of the unique features within this dual MRI suite. We want to thank Wheaton Franciscan for inviting us here today and our associate architects that work with us on the project, PRA. We hope you enjoy the tour.
So now we're going to take a look at the outpatient path through the MR Center. And the first thing is we have a waiting room for the outpatients. In order to get from the waiting room into the heart of the MR Center, everything is access controlled. And you either need to have the card or you need to have trained authorized personnel come and escort you as the patient into the room. Once we enter the area, we are now inside the MRI Zone 2. Inside Zone 2 is where we'd conduct patient screening. If the patient needs to be changed out of their street clothes, we have lockers for boots or winter coats or patient belongings, both outside changing rooms and inside changing rooms. We have a restroom inside the MR unit. This specifically serves the outpatients. We also have a number of changing rooms, and we've made a point of designing these change rooms oversized. We do this on purpose because oftentimes MR patients will show up with a family member or a caregiver. Also, the MR department staff will conduct the final screening, and the rooms are sized such that the patient and the staff member can both be in the room at the same time. In addition to the changing rooms, we also have an IV prep area. This is for patients who are going to receive IV contrast for their MR exam. And again, the room is appointed with storage for all of the IV needs. It's also large enough that they can bring in a nurse if they have a patient who has a port or has a difficult time getting an IV started. In addition to the patient amenities, inside the controlled access part of the MR suite, we have a staff break area. This is so that the staff, even when they're on break, are close at hand. MR safety is a very important thing, and having trained personnel close at hand is always an advantage. So we included a staff break area inside the MR suite. There's also a storage alcove. If a patient comes with their own wheelchair or portable oxygen tank, this is an area where we can store ones that would not otherwise be safe in the MR area. And we also have the MR appropriate wheelchairs and equipment to switch out if need be. Now, once we have had the patient prepped, changed, and divested of any material that might go flying into the MRI scanner, we do one final check with a ferromagnetic detector. Now, these are recommended by the American College of Radiology and are called for in the newest versions of the hospital building codes. And you'll see as I go through that I will set one of these off because I still have ID badge and other ferromagnetic material that won't go into the magnet room. Once we've done all this, there's still yet another controlled access point that gives us access into the MR control area. In here, we have a shared MR control room between the two magnets. One of the great things about shared MR control rooms is it allows for cooperation and collaboration between the technologists. One technologist can see the other one. The other thing is that each technologist can also see the entry room to the other magnet. This provides an overlap of control features.
One of the things that we want to show in this is the dedicated inpatient access that we have. Directly behind me are the inpatient elevators. So the patients will be brought down from the bed tower, come down this way in order to have a dedicated entrance into the MRI suite. This allows for better patient privacy. We also, as you'll notice, we have a secure entrance here. So it requires prox card use in order to be able to enter into the suite or access from the technologist inside. One of the things that's also important about this is because this is a secure entrance for housekeeping, housekeeping has access to the clean holding area from the outside. Once we go into this zone, you'll notice we have a second door. We have clean hold on this side, which allows the MRI staff to be able to access this without having to go outside of the secure area and go through the screening process. Now you'll notice here what we have here is a very nice large area for assisting us with inpatient transfer as they're brought down. We have MRI safe oxygen. We have all the equipment in here is all MRI compatible. And one of the things that you'll notice that's different about this side as opposed to the outpatient side where we went through the ferromagnetic detector pillars for those, in this particular location, because the carts that the patients are coming down on typically are going to have ferromagnetic material in them, we use a wand scanner that allows us to do a closer, better scan of the patients that would be coming down in a gurney for the inpatient situation. So we get the best of both worlds between the portal scanner and the wand scanner. Now, directly behind us here, this is the inpatient holding area. As you can see, fully equipped with med gases for head walls. So this allows the MRI staff here to both fully prep patients prior to the MRI scan and then to recover them after the scan without wasting valuable time within the scan room itself. The other thing we need to point out is the situational awareness for the MRI technologist that sits at the counter has a full view of both the inpatient holding area directly behind me and of the two access doors that we came through out of the inpatient access path. In addition to the technologist, if we bring down a patient that has a high acuity level, we actually have a dedicated nursing station down here so that a nurse, if they accompany the patient down, can do charting while they're here in this space. That then opens up to the same common control room that we had, you saw when Toby came in, where both of the technologists have awareness of each other and can see both of the control consoles. One of the other things that we have in here, you notice, is that we have a dedicated patient toilet that is on the secure side, essentially in the Zone 3 area of the MRI suite. This allows us that if we have either an outpatient or an inpatient that has already gone through the MRI screening process, needs to use the restroom, they can use that without having to go back out and be re-screened. All of this helps with throughput, being able to manage your patient flow so that we don't waste time and we can maximize the number of patients we see over a given day. One of the other features we'd like to point out that's obvious is the size of this particular control room. That was deliberate as part of the overall design process. Not only was this control room designed to be wide enough, as you can see, the windows at the far end serve as the magnet delivery path to be able to both bring in these original magnets and to replace magnets over time. So rather than having knockout panels in each of the scan rooms, we simply have one exterior knockout panel which allows us to bring both magnets into these rooms and then into the scan rooms. It also allows for a more generous use of space within the overall control room.
Throughout the design of this process, we identified a number of opportunities where storage for equipment and supplies, consumables, it just doesn't show up on most of the design templates that you get from your MR equipment vendors. And so we made a point to provide work surface, counters, storage, from work areas inside the shared control room to secured consumable storage within the control area, accessible off of the control area, to significant amounts of storage and casework inside the individual scan rooms. These areas for keeping all of the consumables tend to be kind of last-minute thoughts in the design of many facilities, which often means that they're undersized, underprovided. This can dramatically impede an efficient workflow if the technologists and the MR departmental staff have to continually leave the department or leave the area to go fetch materials, fetch supplies. So one of the things that we wanted to make sure of was that wasn't a problem in this facility and that there was ample storage for what they would need on a daily basis.
One of the things we'd also like to highlight is this is a view into one of the scanning rooms. Not only was care taken in terms of the finishes to make the scan room as nice as possible, including the overhead mural that we have for the patients, the rooms are also oversized. This is done intentionally to allow us to be sort of future-proof these rooms, to give them the maximum flexibility in terms of being able to provide different types of care or interventional care within the space. So again, not designing the spaces to the minimums was key in the overall layout for this facility.
We've paid a lot of attention during this tour looking at the individual features and benefits of this particular facility layout and design. And it's important to note that each and every one of those, whether it's the access controls, whether it's the storage areas, whether it's the ferromagnetic detection system, or how the zones are laid out, each and every one of those is secondary. It's easy to copy and paste individual details, but for this facility, what really drove all of those decisions was a much bigger picture strategic vision. And that was to design a facility that met the patient care needs today and into the future, as well as complement the technical requirements for siting the MRI equipment. Those big picture goals actually determine which one of the features and the layout elements got included in the ultimate design. We can do copy and paste, we can include an element that we've seen in another project, but really it's important to identify what the needs of each facility are and respond individually to those needs. Now, when it comes to needs assessment, the analogy we like to use is that of a rowboat. Now, when you're piloting a rowboat, you're actually facing backwards to go forwards. When you're doing a needs assessment, you are actually looking back historically over, did we have the capability, did we have the staff, did we have the appropriate space to be able to meet patient needs last month, last year, 2 years ago. So that's an entirely retrospective approach, which is great, except you run the risk, if that's all you do, of, at the end of the project, having a facility that's perfectly designed for your needs 2 years ago. If you want to have a facility that is designed to meet not only your contemporary needs, but also looks forward, you need not only the rowboat rower, but you need somebody who is looking forward. And that's part of what we tried to do with this particular project. We tried to not only address the needs that had been already defined, but we tried to look forward in terms of what clinical utilization might be, what new equipment and technology might be, and what the economic pressures would be on the facility to design an MRI suite that responded to each and every one of those new challenges as they crop up. We'd like to thank you very much for joining us on this tour. We hope that you've learned a little something about the Wheaton Franciscan All Saints MRI facility, and more importantly, about what it takes to plan, design, build, and operate a very effective, very efficient MRI facility. Thank you very much.